Most people believe that if their cholesterol numbers look fine, they are somehow protected, almost like they have a shield against heart attacks. But reality works very differently, because what doctors have observed again and again is something that feels counterintuitive. Individuals with perfectly normal cholesterol walking into emergency rooms with massive cardiac events, while others with higher numbers continue living without symptoms. And this contradiction forces us to look deeper into what is actually happening inside the arteries. Because cholesterol alone is not the full story, it is just one layer of a much more complex process that involves inflammation, particle behavior, and genetic signals that are invisible in a standard lipid panel. And once you understand that, everything changes, especially the way you interpret your own health reports, because instead of focusing on a single number, you start looking at patterns that explain why plaques form, why they rupture, and why timing becomes unpredictable. And that brings us to something most people completely overlook. A silent process that can turn a harmless buildup into a deadly trigger within seconds, and it has nothing to do with how blocked your arteries look on paper, but rather how unstable the internal environment becomes over time. Because when the body is in a constant low-grade inflammatory state, even a small plaque can become dangerous. It can weaken, rupture, and create a clot that suddenly blocks blood flow. And this is exactly how many heart attacks happen without warning, not from large visible blockages, but from unstable ones that were never considered critical. And this is where a specific blood marker begins to reveal what cholesterol cannot show, something that reflects the hidden fire inside your body, a signal that quietly rises long before symptoms appear. And if that number crosses a certain threshold, it tells a completely different story about your risk, one that most routine tests fail to capture. And what makes it even more alarming is how easily it can go unnoticed unless you specifically look for it, because standard reports do not emphasize it, doctors may not mention it, and yet it holds critical insight into whether your arteries are stable or on the verge of disruption. And once you see how this marker behaves, you start to question everything you thought you knew about heart health, because suddenly, prevention is no longer about lowering cholesterol alone. It becomes about calming an internal storm that most people do not even realize exists. And just when you think this is the missing piece, there is another factor, even more deceptive, something written into your biology long before your lifestyle choices ever began, something that can quietly increase your risk even if everything else looks perfect. There's a group of people who do everything right, they eat well, they exercise, they maintain healthy cholesterol levels, and still their risk remains elevated, not because of what they are doing wrong, but because of something they were born with, a hidden genetic factor that does not show up in basic screenings. And this is where another blood test becomes critical, because it identifies a specific type of lipoprotein that behaves differently from the usual LDL particles. It carries an additional protein component that makes it more adhesive, more likely to stick to artery walls and contribute to plaque formation. And what makes this particularly dangerous is that it does not respond easily to lifestyle changes, meaning diet and exercise alone may not significantly reduce it, which is why many people remain unaware of their risk, assuming they are safe simply because their cholesterol appears normal. But this particle operates under its own rules, quietly increasing the likelihood of buildup over time. And because it is genetically influenced, you could have it even if no obvious symptoms are present, making it one of the most underestimated contributors to cardiovascular disease. And what complicates things further is that it does not always correlate with traditional markers. So someone with excellent LDL numbers could still have elevated levels of this particle, creating a false sense of security. And this is why testing it at least once becomes so important, because it gives you insight into a dimension of risk that standard panels completely miss. And once identified, it changes how you approach prevention, because now you are not just managing lifestyle. You are managing inherited tendencies that require a more targeted strategy. And the moment you realize this, it shifts your entire perspective, because now the question is no longer whether your cholesterol is normal, but whether your overall particle behavior is safe. And that leads to an even deeper layer of understanding, one that goes beyond concentration levels and starts counting something far more revealing, something that directly reflects how crowded your bloodstream really is. Because imagine a highway, not defined by how many passengers are inside the cars, but by how many vehicles are actually moving, because the more vehicles there are, the higher the chance of collision. And in your bloodstream, those collisions translate into plaque formation, progression, and eventual complications. And this is where the most powerful measurement begins to change everything you thought mattered. What if instead of estimating risk based on how much cholesterol is present, you could actually measure how many particles are capable of causing damage? Because that distinction alone changes the entire framework of prediction. Since concentration can be misleading, you might have fewer particles carrying more cholesterol, or many particles carrying less. but it is the number of particles that determines how often they interact with artery walls, how frequently they penetrate, and how likely they are to contribute to plaque development. And this is exactly what a more advanced marker reveals. It counts every atherogenic particle that has the potential to initiate damage, giving you a direct measure of exposure rather than an indirect estimate. And this is why it is considered one of the most accurate predictors of cardiovascular risk, because it removes assumptions and focuses on actual particle presence. And when that number is high, it indicates a crowded environment where interactions are frequent, increasing the probability of buildup over time, whereas a lower number suggests a cleaner pathway with reduced risk. And this clarity is what makes it so powerful, because it aligns more closely with real outcomes rather than theoretical estimates. And once you understand this, it becomes clear why relying solely on traditional cholesterol numbers can be misleading, because they do not account for particle count. They do not reflect how many carriers are actively moving through your bloodstream, and they do not show how intense the interaction with artery walls might be. And this is why two people with identical cholesterol levels can have completely different risks, because their particle counts may be drastically different. And when you begin to see your health through this lens, it changes how you interpret every report, every number, every decision. Because now you are no longer guessing. You are measuring what truly matters. And yet, despite its importance, many people never get this test done. Not because it is unavailable, but because it is not part of routine screening, which means unless you specifically ask for it, you may never know where you stand. And that is where the real danger lies, not in what is detected, but in what remains hidden. Because sometimes the most critical information is the one thing no one thought to check. There is a group of people who follow every guideline, they avoid junk food, they stay active, their reports come back looking clean, and yet something beneath the surface continues to move in a different direction, something they cannot feel and cannot see because this particular factor does not behave like typical cholesterol. It does not simply rise and fall based on what you eat in a week or how often you exercise. Instead, it is influenced by your genetics, almost like a preset code that runs quietly in the background, shaping your risk without asking for permission. And what makes it even more concerning is how easily it blends in with normal results, because standard lipid panels do not highlight it clearly, leaving many people unaware that their arteries may still be under pressure. And this is where a specific type of lipoprotein starts to stand out. Not because of its quantity alone, but because of its structure. It carries an additional protein attached to it that changes its behavior, making it more likely to stick to arterial walls, more likely to participate in plaque formation, and more resistant to the usual methods people rely on to improve their health. And once it begins circulating at higher levels, it quietly increases the chances of long-term buildup, even if everything else looks controlled. And that is why some individuals experience cardiovascular problems despite having numbers that seem perfectly acceptable, because this hidden variable was never accounted for. And the moment you understand this, it forces you to rethink what normal actually means, because normal does not always equal safe, especially when genetic factors are involved. And this is why testing it even once in your lifetime can reveal something incredibly important, a baseline that tells you whether you are dealing with an inherited risk that requires a different level of awareness. Because ignoring it does not make it disappear, it simply allows it to continue influencing your system unnoticed. And what makes this even more complex is that lowering it is not always straightforward. Lifestyle adjustments may help slightly, but they often do not produce dramatic changes, which means management becomes more about understanding your risk rather than completely eliminating it. And that shift alone changes how you approach prevention, because now you are not just reacting to numbers, you are anticipating patterns. And once that mindset changes, you start asking better questions, you start looking beyond the obvious, and you begin to realize that even a perfect-looking report can still hide a silent imbalance that continues to build over time. And just when you think you have identified the main issue, another layer appears, something even more precise, something that does not just look at types of particles, but actually counts them. And that is where the real clarity begins to unfold. What if the real problem was never how much cholesterol you have, but how many particles are actually moving through your bloodstream at any given moment? Because that distinction changes everything. And once you begin to see it, you cannot unsee it, because concentration alone can create an illusion of safety. You might have a normal level on paper, but still carry a high number of particles capable of penetrating artery walls, and each one of those particles represents an opportunity for damage, an interaction that can slowly contribute to plaque formation over time. And this is where a more advanced measurement becomes incredibly powerful, because instead of estimating risk indirectly, it directly counts every atherogenic particle that has the potential to cause harm, giving you a clearer picture of what is actually happening inside your body. And when that number rises, it reflects a crowded internal environment where the chances of collision increase, where particles repeatedly come into contact with arterial walls. increasing the likelihood of buildup, instability, and eventual rupture. And this is why two people with the same cholesterol numbers can have completely different outcomes, because one may have fewer particles carrying more cholesterol, while the other has many particles carrying less. And it is the number that drives risk, not just the load. And once you understand this difference, it becomes obvious why traditional lipid panels sometimes fail to predict real-world events, because they do not measure particle count. They only measure how much cholesterol is being transported, not how many carriers are doing the transporting. And that gap in information is where misinterpretation begins, leading people to believe they are safe when in reality their exposure is still high. And this is exactly why this particular marker is considered one of the most accurate predictors of cardiovascular events, because it aligns more closely with actual outcomes rather than assumptions. And when doctors begin to rely on it, the entire strategy shifts from guessing risk to measuring it with far greater precision. And yet, despite its significance, many people never get tested, not because it is unavailable, but because it is not part of routine screening, which means unless you specifically request it, it often remains unchecked. And that is where the real danger lies, not in what is found, but in what is never measured. Because the absence of information can create a false sense of control, and that illusion can delay action until it is too late. And by the time symptoms appear, the process has already progressed much further than expected, which raises a critical question. If the tools to see risk more clearly already exist, why are so many people still relying on incomplete data?